Benzodiazepines, codispensed opioids, and mortality among patients initiating long-term in-center hemodialysis. Patients on hemodialysis suffer from a high burden of physical and psychiatric conditions, which are treated with benzodiazepines, and they are 3 times more likely to be prescribed opioids than the general population. Thus, patients on hemodialysis are likely at elevated mortality risk resulting from benzodiazepine-opioid interactions. 69,368 adult patients from the U.S. renal data system who initiated hemodialysis from January 2013 to December 2014. Co-dispensing was defined as concurrent prescription of benzodiazepine and opioid on the same day. They used adjusted Cox proportional hazards models to estimate the mortality risk associated with benzodiazepines and tested whether the benzodiazepine-related mortality risk differed by opioid co-dispensing. Within 1 year of hemodialysis initiation, 16% of patients were dispensed a short-acting benzodiazepine, and 5% were dispensed a long-acting benzodiazepine. Short-acting benzodiazepines was defined as a half-life less than 24 hours and long-acting more than 24 hours. Patients who were older, women and white, were more likely to be dispensed a benzodiazepine within 6 months of hemodialysis initiation. Co-dispensing of opioids and short-acting benzodiazepines occurred among 26% patients, and co-dispensing of opioids and long-acting benzodiazepines occurred among 8%. Patients with a benzodiazepine were at 1.31-fold greater mortality risk. Patients with a short-acting benzodiazepine had a higher mortality risk, and those with a long-acting benzodiazepine were associated with a lower mortality risk. Check the table. Lorazepam had the higher mortality risk and only clonazepam was associated with a lower mortality risk. Among those with opioids, short-acting benzodiazepines were associated with a 1.90-fold higher mortality risk compared with those without short-acting benzodiazepines. Among long-acting benzodiazepines, the mortality risk associated with long-acting benzodiazepines did not differ. Check the results. Low-dose, long-acting benzodiazepines may have a more favorable risk-benefit because they are associated with more delayed and attenuated withdrawal symptoms like less interdose anxiety. Limitations: exposures were limited to dispensed prescriptions, illicit use of benzodiazepines was not captured, they were unable to separate the medication effects on mortality from the effects of the underlying conditions, and there was no cause of death. Conclusion: co-dispensing of opioids and short-acting benzodiazepines is common among patients on dialysis, and it is associated with higher risk of death. Kidney Today. Thanks for watching.